Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, come on in. It's Mrs. Thompson, correct?
Yes, that's me, Anna Thompson.
I understand you've been referred here due to recurrent migraines. Is that accurate?
Yes, unfortunately, this isn't my first round with them.
All right, I have a brief summary in front of me, but it'd be great if you could explain your experience, any prior treatment you've received, and any other relevant information.
Okay, it started about 2 years ago. I was dealing with a lot of work stress, and suddenly one day I had this blinding pain on one side of my head. It was debilitating. Over time, the migraines started occurring more frequently. Then about 6 months back, they seemed to fade. But now, over the past 3 weeks, they're back and stronger than ever.
I'm sorry to hear that. Did your GP confirm these as migraines?
Yes, I had light sensitivity, nausea, and even vomited a few times. The GP said it was classic migraine. Honestly, the pain is so intense that sometimes I can't even think straight. I need to lie down in a dark room and just wait for it to pass.
Sounds tough. How did you manage the pain before?
I was given some prescription painkillers, and they advised me to try over-the-counter pain relief too. I also tried a cold compress on my forehead sometimes. It gave a bit of relief, but not for long.
Anything else?
Yes, I was also referred to a neurologist. They did some tests, including an MRI. Everything seemed normal. The neurologist prescribed a different medication and suggested some relaxation techniques. I even attended a few meditation sessions.
Interesting. Did any other treatments come up?
I remember being told about biofeedback therapy. I never got around to it. I also tried aromatherapy with essential oils. They were soothing, but didn't always prevent a migraine. Some of my friends suggested acupuncture, but I haven't tried that yet.
Out of all these approaches, which one felt most beneficial for you? What helped the most?
It's hard to pinpoint. The relaxation techniques helped a bit in preventing, and the painkillers helped in managing the pain. But nothing seemed to completely stop them from coming back.
All right. Has anyone discussed potential triggers or factors in your daily life that might be contributing to these migraines?
Not in depth, no. I've tried tracking my diet and sleep, but I couldn't find a consistent trigger. I suspect it might be stress-related, but it's just a guess.
Well, we'll look into that further and try to find the best approach to manage and reduce these migraines for you.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mr. Thomas Brigg, you can come through now.
Thank you.
All right, so your GP referred you to us about the persistent rash on your leg, correct?
Yes, that's right. I first noticed it a few months ago. It's here on my calf. It's been on and off. Sometimes it seems to be clearing up, but then it just flares up again. I showed it to my GP, and he thought it best if a dermatologist had a look. He also sent some pictures. Did you receive them?
Yes, I did. I've reviewed them. Now, can you describe to me how it feels when it flares up?
It usually starts with a bit of burning sensation. After a day or two, it gets itchy, and then these tiny red bumps start to form. It gets quite itchy at times, and I find it difficult not to scratch. After a while, the bumps sort of merge, and it becomes this inflamed patch. I remember my GP using the term irregular for the rash's borders. Eventually, it subsides a little, and then the cycle repeats.
I see.
It's odd, though. I lived in South America for a few years, and I recall having a similar rash during my time there, but it disappeared once I returned home. I just assumed it was something to do with the climate there. But now it's back, though I've been here for years. There doesn't seem to be any trigger, not food or stress or anything of that sort.
And did you have any other medical issues, any surgeries or past skin conditions to be concerned about?
Well, about a decade ago, I had a cyst removed from my shoulder. It was benign, though, nothing concerning.
All right, let's take a look at that old surgical site. Was it on this side?
Yes, right there.
Okay, this seems to have healed well. Now, coming back to the rash on your calf, it doesn't appear to be malignant or related to the cyst you had removed, but I can understand your concern. By any chance, have you ever had chickenpox?
Yes, when I was a child, but that's a long time ago. Why do you ask?
Sometimes, certain viral infections from the past can reappear in different forms. Though I'm not suggesting that's the case here. I'm just gathering all the information I can.
I see. I had heard about antihistamines for allergies. Can they help with the itchiness?
Yes, they might help reduce the itchiness, but I wouldn't rely solely on them. The underlying issue still needs to be addressed.
Right. I also don't want this to spread or become infectious. Should I keep it covered?
Unless there's open skin or oozing, it's okay to keep it uncovered. But to get a better understanding of what's causing the rash, I suggest we do a skin biopsy. It'll give us more clarity.
That sounds like a plan.